Good evening, everyone, and welcome to the 29th annual ACVC. I can't believe it's been 29 years. I haven't been here for all of them, but I'm logging in at about 17 years of participation with ACVC, either as a speaker or now in my role as Director of Education. And it's very exciting to me. You might have noticed if you've been to ACVC before, it looks a little bit different already. And that is because we were purchased by American Veterinary. I'm sure all of you are familiar with American Veterinary, who've been a leader in multimedia disbursement of education and information about our profession for quite a while. And it was a natural fit then that they became the people that put on now a live veterinary conference. So this is our first year being put on by American Vet, so I'm excited, and thanks to American Vet for that. This is the first thing that we're doing, which is very different for us. We're starting off with some controversy. Why not? This is the Crossfire event, and I should say verbal Crossfire event. I want to make that really clear in case there were any questions, but we are going to have some interesting discussion tonight. I'm very pleased that you've all decided to be here with us. I do need to make a couple housekeeping announcements. That's always the case. First, as you can tell, we're being filmed. So if you wouldn't mind silencing anything that's on your person that might make noise, that would be much appreciated if you would do that right now. We're also going to, as part of our format tonight, we're going to meet our presenters in just a few minutes. And then we're going to invite questions from the audience. And we're not going to have people jumping up and hollering out stuff for obvious reasons, but there will be directions up on the screens on either side to tell you how to send a question up to me. And when we get to that portion, I'll be able to see your questions and ask them on your behalf. I assume there will be lots of interesting questions that come out of the next half hour or so. So I guess always the most important thing is that the restrooms are located just outside this building, this room. Okay, so I want to introduce you to this panel, and I'm pretty excited to be the moderator tonight. I think I'm excited about it. We'll see in a few minutes. But we have three really illustrious members of our panel tonight, so I'm going to introduce them to you. They're going to come up here as I mention them. The first one is going to be probably best known for his role on Animal Planet, although I understand he plays a vet in real life as well. Dr. Jeff Young, who's the founder of Planned Parenthood International in Wheaton Ridge, Colorado. And Jeff has lectured and performed surgeries in over 36 countries, so he brings quite a lot of experience to the podium. Welcome, Jeff. And then we have Adam Christman, who's from our very own local New Jersey, from Brick, New Jersey. He's the chief of staff at Bricktown Veterinary Hospital. And you may know him better as the host of a very popular YouTube channel where he does some pretty interesting programs for pet owners. And last but certainly not least, we have Liz Hughston, who joins us all the way from San Francisco. Liz is representing our RVT, CVT, VTS group tonight. That's a lot to cover, Liz, but she's a relief technician and a trainer and a consultant and a very prolific lecturer all over the world, particularly in the area of emergency and critical care. So welcome to all of you. Thanks for being here.
Thanks.
Thank you. Hi, everybody.
Thank you.
So we've had a chance to chat, the four of us, a little bit, get to know each other a little bit. And it turns out we actually have more in common than we have apart. And that's really important. I want to kind of set the stage, as we talked about before, with some of the things we share. And I think probably we share a lot of these with all of you as well. So that we'll kind of check in with you to see how you're feeling. But the first thing is, of course, you're looking at a group of people who've dedicated their lives to helping animals and to advancing the field of veterinary medicine. I think that's why we're all at a CE conference. It brings us all together, and at the base, regardless of how we get there, all of our goals are united in the pursuit of really great animal care. Fair enough?
Right. Fair.
I haven't lied yet?
Not yet.
We're good, okay. The next thing is we had this pretty interesting discussion about how we feel about euthanasia, and it's on the table tonight to talk about how we feel about being asked to euthanize animals for reasons other than because we believe it's the right time and there is nothing left for us to do from a medical perspective. So that means if someone is asking us or putting us in a position to euthanize based on financial constraints, or based on just some inability or lack of desire to go forward. And that puts us all in difficult positions, and I want the panel to address the way they deal with that, because there's a number of different approaches. And I think we also agree that there is a great need to control the animal population all over the world, right? Not just here in our country, but 100%. All over the world. That rampant population explosions, particularly of dogs, but dogs and cats, is a major problem worldwide. And we have, and each of us plays a role in some way or another in trying to help control that. So we'll address that issue as well. And then finally, I think what's interesting about all of us is that we all are in the public eye and have been in the public eye for many, many years. And when you're in the public eye, whether you're on a major television show, right, like Dr. Jeff, or you're
major.
It's a major on Animal Planet, or you're on a more local, or YouTube, I guess isn't really local, is it?
It varies.
Yeah. Or whether you're lecturing from podiums all over the world, you're facing the public all the time, the veterinary public as well as pet-owning people. And when you do that, there's an obligation to present the face of veterinary medicine the way we would like to be reflected in their eyes. So I'm going to start with that, actually, and I'm going to go down the panel, just ask everyone to speak for a couple minutes, if you would. I'll start with you, Adam, since you're down there.
Okay.
And if you would just talk just for a couple minutes about how you feel your role to represent the public and what your priorities are when you do that.
I think all of us as veterinarians, we all have a moral and ethical obligation to pet parents, right? And I think just being in the face of social media or whatever it is, it's all about education and just creating some sort of a bond, if you will. And me personally, I like to evoke emotion. And it starts out with just a couple of videos that I just happen to do, say, hey, this dog is lost, you know, we need your help, please share this video. And overnight, it gets over 700 shares, and it turns into something bigger than I ever thought it was. And I realized we all have something here, whether it be a connection through social media, through a TV show, or just one-on-one with those clients. Ultimately, I always feel like it's about educating the clients and having a moral and social responsibility to the community. And I just enjoy just having these conversations and Facebook chats with clients and just really engaging them on different levels that's outside of a 20 or 30-minute office visit.
Great, thanks. Liz, you want to
thank you. So not only do I lecture, I administer a bunch of different Facebook groups that are geared towards veterinary professionals. And I think that it is our responsibility as people who are in charge of groups like that or active on social media or lecturing to really represent the gold standard of care. And that's my objective when I lecture, is to talk about the gold standard while also realizing and representing to people that there are shades up and down that spectrum, from no care to the gold standard of care of specialty medicine, for example, or university type medicine or something like that. So I think that that is really important for us when we have these discussions, is to recognize the varied needs of the public and our profession and how we can serve the public best while also advocating for the gold standard of care in everything that we do.
Great. Over to you, sir.
I mean, I'll be honest, I didn't put a lot of thought into being on Animal Planet in terms of what it was going to do to me or my practice. I had 86,000 clients before I was ever on Animal Planet. I've been lecturing for over 25 years around the world and doing surgical demonstrations. And I've been shocked a little bit by some of the pushback. And at the same time, I feel like I have an incredible fan following. I've talked to literally hundreds of veterinarians that really like what I do. And there is, I've always said since day one, you can take the Volkswagen, you can take the Mercedes, to the prom, but both get you to the prom. And there's lots of ways to get to the same end. And it does come back to cost, I mean, as a profession, in the last 2 decades, we see a smaller percentage of overall animals in the United States than in the preceding decades. And it's simply because we're pricing ourselves out of the market. And that's not to say we're overcharging, it's just that society's pay hasn't kept up with basically human-animal standards. We've taken human medicine, shifted over to animal medicine, and it's expensive, and there's nothing wrong with that. But in reality, there's about 20% of the people who can afford that. In underserved and poor communities, 77% of the animals never see a vet in their lifetime. Those are my people.
Thank you. So let's just dive a little deeper into that. I'm going to ask you just to talk, if you would, for a few minutes about what do you think the effect is of the socioeconomic status of the area in which you work or find yourself, or
Right.
is our standard shifted? Do we have a different approach if we're dealing with low-income people versus or underserved nations versus you're in a wealthy area of the United States or even a poor area of the United States? I'll start with you on this one, Liz, if you don't mind.
Yeah, sure.
Okay.
I think I'm a good place to start because I live in the Bay Area, the Bay Area of California, so I actually live in Silicon Valley. And nowhere is it more obvious to me the stark difference between the 1% and the 99%. It's a huge, huge difference. And I think we are doing a disservice to those members of our community who are of lower income and can't afford always doing the gold standard level of care, even if they want to. And I would like to say too that in some of this discussion that occurred online around this appearance of Jeff I saw some really disturbing comments from veterinary professionals saying that if you can't afford a pet, you shouldn't have a pet. And I just don't think it's not representing us very well, and that's not who we are as a profession. I don't think that represents our empathy or our compassion for all pets and all pet owners. And having worked in many low-cost spay and neuter programs, and having worked in shelter spay and neuter programs and feral animals and working on homeless clinics, I can tell you that those people love their animals and need their animals as much as the 1% do. You know, I've treated everything from Michelle Pfeiffer's dogs to homeless people's dogs in Santa Cruz. And so the bond is the same. And I know Adam is a big proponent of the human-animal bond, and I think that that's something we need to remember when we're trying to serve these communities and finding a way to serve everyone in our community, all the pet owners.
So I'm going to keep going, and if no one you should be scrolling madly questions right now at this point. But if no one asks this, I will probably circle back and say, so how do all of you, deal with the lower income people? What do you change? Mm-hmm. Do you change the quality of the care? Do you change what you offer to them in terms of drug protocols? I mean, if you have to cut corners, where are they being cut, or how are you compensating for that? Now I'm turning to you.
Well, I mean, you can say it's cutting corners, but in one sense, my question is always the same, is that if I do this, what's the side effect? And if my outcome is the same, then obviously I feel like I can get away with doing it, you know? And my new vets that come in get giant drapes, and I understand they need it because they're so intent on looking at a certain surgery. And that giant drape costs me 40 cents. If I cut it in half, it costs me 20 cents. And if I cut that in half again, it costs me 10 cents. And if you're doing 15, 16,000 surgeries a year, it all adds up. And that's the point. And I'm real conscious of that, and I point out to them. Now, they may use a giant drape for the first year, but eventually they get it proficient enough where they don't need a giant drape. And I do think you have to worry about cost. I think the veterinary profession is really bad about understanding cost in our own hospitals, and I really feel like I have that down pat. And I think you can cut quite a few corners without sacrificing good quality of care. You know, we don't cut back on the antibiotics and things like that, when the suture material I use is good, but I think more than anything, the time on the surgery table is a big factor, so I think becoming really proficient at surgery really does matter. There's no question that my new surgeons have a lot more problems than my older surgeons, you know, and there's just something to be said for that. So having said that, in the end, my feeling is my goal is to get that animal back into the same family under almost all circumstances. And there's some people that clearly just don't care about their animal, and they're not going to spend more than $1.95 on it no matter what. And those rare exceptions are the times we end up taking those animals. Both my dog and my cat were animals that were slated for euthanasia for no other reason than my dog ate a sock, wasn't worth it, put them to sleep. I offered to pay them $300 to do the surgery and for them to keep their dog, and they still didn't want that. So the cat, same thing, you know. Yeah. So in the end, you can only do so much because we are dealing with human beings, but our obligation should be to get the animal back in the home it came from.
Mm-hmm. Okay.
I mean, we've all been through these situations too. I have no money, I have a blocked cat, I have, bladder stones, and we all know that those are treatable situations, and we do what we can as a team And even as a practice or community, we come together and do what we can to help these pet parents out. The last thing that I would ever want to do is try to rehome that one to another home. You try to keep that bond as important as possible. So if it's a matter of cutting costs where we say we won't charge for patient monitoring, but we still will do patient monitoring and recovery, or hospitalization for the day, we won't charge for hospitalization. So yet we can still do the right thing. And I always say this to everyone, there's a difference between doing what's right versus doing the right thing. And our profession is such a perfect example of doing the right thing. And we do it all the time. I wish human medicine sometimes can learn that sometimes. But
yeah. And not to interrupt, Adam, I'm sorry, but I think it's an interesting point about the business side, and Adam, you have an MBA, so you clearly have a better understanding of the business side than a lot of veterinarians out there. And I think that is part of the issue, is that veterinarians don't actually know where they can discount. Like this, saying, okay, we're going to do the monitoring and I'm going to take the hit of that, of the pay that I'm giving that veterinary technician. I'm going to take that hit because I know it's the right thing for the animal, and I still want to provide the monitoring, and I'm just going to take the hit on this procedure and figure out how that's going to affect your bottom line.
Absolutely.
So let me just ask one corollary question. I'm going to stay on you, Adam, when I ask this, but how do you keep the lights on then? And I want you to answer this too, Jeff. How do you keep the lights on while providing the same great standard of care to people who can't afford it?
Honestly, it's word of mouth. That, by saving an animal's life, whether it be, say, you do a cystotomy for maybe $500 or even less, we have an angel fund, whatever it is that we put together. My fellow chief of staff, Mary Lou Bronco's right here. We know, we've been through it. But that person, what we have found, will say so many things about how wonderful ABC Animal Hospital is. Oh my gosh. So you know that you're going to be bringing in more clients that way too. So again, it's doing the right thing. You may not make a big profit on that particular procedure, but long-term wise, it's going to be a great investment for the practice.
Excuse me one second. How many people have an angel fund or a similar type fund in your hospital so that you can underwrite some of these? A lot. Okay. Do you want to comment on that a little bit more?
I mean, I guess I haven't advertised. Before I was ever on Animal Planet, I stopped advertising 15 years before I was on Animal Planet because everything was word of mouth, and that's the point. I mean, if you do the job right, people stand behind you, and there's times you do a cardiac surgery for $100, and there's times you charge $1,500 for it. And I've never found that to be a problem. I'm a for-profit corporation. I have a nonprofit branch. My nonprofit branch does most of the work overseas on Indian reservations, things like that. We don't necessarily. I just take a hit out of my own pocket. But in the end, if you do volume, and at that point we were doing 15, 16, 18,000 surgeries a year. We're down a little bit more now because we're doing more complicated ones. But in the end, if you do volume, you're not afraid to work. But not everybody likes to work the way I like to work. But I really love what I do, so I feel very fortunate in that way. But you can find a balance, and I think that's the key.
Okay. And the euthanasia question, I brought it up briefly before, but just to touch on that, I guess I'll start with you this time. Why not? Like the question, if you forgot kind of what we raised before, is how do we deal with, and I bet every single person here has faced this, if not this week, last week, the owner that wants to euthanize for a reason that doesn't quite fall under our umbrella of a good death because we're doing something humane, and you're being asked to do it for some other reason.
That's simple for me. We just don't euthanize. We won't do it. If the animal is healthy and if it's fixable, broken leg, whatever, it's like you can. If you really want to kill it, sign it over to us. Or if the price is the issue, I'll do it for $200 or $300. And if you get it down to $200 or $300, you're offering them $100 to do the surgery, and I've done that before, and they don't want to do it. Clearly, they have no emotional attachment to their animal. I have no problem taking the animal in. If they want to take it home, I can't stop that legally. But if it has a broken leg, I call animal control. And believe me, we call animal control all the time because they have to do the right thing by the animal. But that's not going to bring it to my place and have me put it to sleep. They can take it to the shelter or someplace else for that.
Yeah, that would be my concern as well. Is we don't want to turn them away so they go next door and have the animal.
That's what I was going to say, because when we were talking, I really applaud you for not doing those because it's rough on everybody, right? It's rough on staff, especially. Totally. It's rough on veterinarians. So I really applaud you for that stance. But to then say, well, they're going to they won't sign over to you. They don't have the money. They're going to euthanize anyway, so you just send them somewhere else. Then what we're doing is we're passing that problem down the line to another practitioner who has to deal with that. I don't think any
practitioner should. That's what humane societies are for, quite frankly. And we have multiple active humane societies in our area, and you can take an animal there, no question to ask, and they'll make that decision whether they're going to put to sleep or not. But I didn't get in the business to kill animals for no reason, and I'm not going to do it.
Right. I think all of us are in the same boat on that, right? I mean, none of us really would just randomly say yes to that. And I mean, we're all in it just to help these fur babies out big time. And you bring up a really important point about self-care and compassion fatigue, because that does wear on the practices that we see. But again, we do it all the time, day in and day out, but it's something that we always have to recognize that it can really burn you out when you see these cases chronically that happen.
Yeah, and I think it's really, I've been working most recently in general practice, and that's a little bit different, but in emergency and critical care, certainly, it's a real problem.
Yes.
And seeing those animals on an emergency basis, and everything on emergency costs more, and people just really can't afford it. And that can be very, very tough for staff, particularly, because most of the time, right, technicians that are here, it's us having those conversations with the client, and it's us, lending them our phone to make phone calls to friends and family, or pointing them out to angel funds, or ways that they can, or working through the care credit application with them, or whatever it might be. And it's heartbreaking. Those cases are heartbreaking. And I do think there are some ethical concerns with taking surrendered animals. This isn't really that forum, so we can take that offline.
I'm gonna actually stop you there, because I'm getting some interesting questions already. So why not? Right?
Sure.
You're up for that, and this kind of dovetails pretty nicely into what you're talking about. The first question is what is your opinion about reporting abuse? Yeah. And I'm not sure that we're saying that requesting euthanasia when it's not maybe medically necessary falls under abuse. Maybe it does, but certainly that's another issue. What do you do if you suspect, and a person's brought an animal in and you suspect there's been abuse there? Who wants to start?
We report all the time. If we see an animal back within 6 months or a calendar year with a second break, we start asking all kinds of questions. I mean, we're advocates for animals, and that's what it boils down to. And we will have welfare checks done. We have a really good investigative team in Colorado, and so it's not that hard to follow up on some of these things. But I see neglect as much more of a problem. And neglect is just uniform across the board, and that's what we all see every day. The horrible dentals, we have no money for the dental, and I see that as a much bigger problem for us as a profession, because those are things that are fixable and treatable, and the people generally care, but it comes back to economics.
Mm-hmm. I think Jersey has a pretty awesome, animal control program too, and we're all believers in if you see something, you say something, and it really does. The investigation really is a good thing, and it's unfortunate. There's things that really do suck. It's like if they have food, water, and shelter, those categories are checked, but yet they're still tied to a pole in the backyard, and they have a bowl that's there. It's really awful, you guys, right? And then how do you, it's just really breaks your heart when you talk about, the differences between ethical dilemmas. That's a biggie. Yeah. And we go through that a lot at our practice in our area too. We see that, and it's like, ooh, what can we do? Because that they just belong with better pet parents.
Yeah, that is so hard. Right. And I think that, like you say, if you see something, you have to say something. And I do think we have an obligation, an ethical obligation, a moral obligation to report abuse if we see abuse. Neglect is hard, and ACOs know neglect is hard, because again, there's a difference in how different people view animals, right? So that's a huge
That's essential to this discussion, is that there is no hard, fast definition of neglect versus abuse versus whoever just sent this up to me, thank you, versus a lack of education.
Right.
Yeah. Well, almost all neglect is a lack of education and finances. Those are the two things that go hand in hand.
And value system. We value our animals differently, so we can't judge them for that too. If they're there just for the rabies vaccine versus a whole canine comprehensive blood profile, it's a different perception. To them, it might be just a dog, which, okay, but to us, they're our babies. We'll do anything for it, but yet we can instill our values into how they perceive their pets as well, so that's tough.
And I think that's a classic conundrum for us in veterinary medicine. That exact question is how we can't put our values on pet owners. And I hear this from new technicians, especially technician students. How do I deal with these people who don't take care of their animals the way I want to take care of their animals, or they're ready to euthanize at a point where I would not euthanize. And there are those situations too where it's not clear cut. They're not doing it for convenience. The animal is ill. They can't handle it, or they can't pay for it, or whatever. And it's not a point where I would euthanize my animal, but it's not for me to say that they're wrong to make that decision for themselves and their family and their lifestyle and whatever. So I think that there's a fine line there as well.
Right. And who's responsible for the education to the pet owning
us.
public? I was asking you. But
Sorry.
I think we are. It's about finding avenues to do that.
I think more than anything, humane societies have done a really bad job. Everybody talks about education, 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 but look at their education budgets and how many actually go into schools and things like that. You want to change the future, you have to get the 9 to 12-year-olds. We know that's the group that has the most impact and willing to absorb things like sponges.
Right.
And animal control or humane society spends something like $2.5 billion or worth a year. That's their operating budgets. How much of that goes into education? Very little. And as a profession, I think how many people have ever asked a veterinarian, what, I have 2 kids, I want to get a dog. What would be a good dog? Like we're supposed to be the professionals, and I've been asked that maybe twice in 30 years, I mean, it makes no sense. So we could do a lot better job of letting people know that we are here for you and we are here to help.
And I think, Jeff, we have to, because these laws are state by state. The humane laws are not even the same across the river right here. So where are the standards going to come from?
We still have puppy mills, for God's sake.
Yeah. Okay, so let me, I'm going to have to put my glasses on and read this one. It's a little bit long, but I want to share this with you, and then maybe you can comment on that. This person has an angel fund and is sensitive to I'm paraphrasing, I'm sorry if whoever this is thinks I'm messing it all up, but the person appreciates low-income issues, but what about vets with so much debt? The person thinks that we need to raise the bar in letting people know the value of veterinary medicine and the education and what new grads are facing in terms of financial constraints as part of, I guess, how we engage the public in a willingness to pay, is what I'm figuring here. Anybody want to comment on that? Please.
I mean, I think the MBA should.
Well, it's really tough, the new graduates nowadays. I mean, I was just looking, the average student debt is somewhere around the range of $200,000 when they come out of vet school, which is unbelievable, you guys. And yet, and many years ago, we never were talking about compassion fatigue, right? And self-care, and that is so huge. So when these new graduates are coming to our practice and they're asking really good, solid questions about, what about my quality of life too? We're not going to be working 50, 60, 70 hours of work a week, and then, we want to pay them competitively, so there's that component. So we want to make sure that there's a good work-life balance. It's really, really important to this profession, too. Can I get an amen on that?
Amen.
Thank you. Thank you.
For the record, my vets work for me. They're scheduled 40 hours a week, and they know that doesn't quite always fit, but it's really rare anyone ever hits 50 hours. Usually it's 42, 43.
But how many
That's
hours
because
do
you're
you
working
work?
100.
Right.
Not me, now my wife does, thank God, so, I get to do a little less. But no, I mean, and if you have your own practice, I think practice owners are more likely to do that, or they get to the position where they have other people do it for them. But to build a practice, you have to put in the time. And but you do that, any CEO of any major corporation, anyone starting out anything, that's the way you work if you want to build something up.
And I'll just interject in this conversation because I think it's relevant, is technician and assistant and kennel staff pay, support staff pay, because I think we all recognize that support staff are woefully underpaid in this industry. Most of us live below the poverty line. Most of us can't support ourselves on what we make. And that is a challenge for the solo practitioner when they're carrying a huge debt load. They're trying to manage their own work-life balance to make sure everybody else has a work-life balance, to remain competitive so that you can hire people and support your staff. We're all empathetic, compassionate people. None of us want our staffs to be starving.
Are you suggesting it's expensive to provide good veterinary care?
Yes, I am suggesting that. And
did you hear that?
I mean, and I think it depends on the level you're talking about, right? I mean, having worked the spectrum, right? So from shelter medicine to humane society, which is a little bit different from shelter, to general practice to specialty medicine, it all varies at every level. Sure. The amount that you have to spend to practice that level of medicine is different. And the kind of support you get is different, right? I mean, I'm not going to put you on the spot as a panelist since you're the MC, but you run a spay-neuter program in a foreign country, and you get donations of drugs, of supplies, of other products, and the specialty clinic, and they shouldn't, but they don't get those donations.
Correct.
And they shouldn't get those donations because they're charging more, but that's also why they charge. I mean, you can see the difference there.
I do want to point out that the AVMA, they have launched a Fix the Debt initiative. I just want to give a little plug on that because their goal is to reduce the debt to income ratio, which now stands at 2 to 1 to 1.4 to 1. So they're doing things by increasing scholarship endowments, advocating to governments, minimizing the cost of borrowing, consolidating loans, things like that, and also telling employers, hey, we're worth more than what we are getting paid. Right. So trying to get that balance.
About time.
Yes.
Yeah.
So we're getting some of the most, you don't see the questions,
Okay.
but wow, it's going all over the place. So I'm going to move us along a little bit.
Okay.
I didn't anticipate some of these topics, I have to say, but we're getting, okay. How do you handle seeing wildlife that are illegal for clients to own? These animals that would be euthanized if the client calls animal control.
Is anything illegal in New Jersey or Colorado? Because
Everything's illegal.
Everything's illegal.
Colorado's pretty good.
I mean, we see, at my old practice, we saw ferrets. We still see ferrets, and ferrets are illegal in California. But they're someone's pet. They have a bond with that animal, and we treat them. Gerbils, too, are also illegal in California, by the way.
Okay, let's not go down these
Sorry.
roads right now.
Well, Dr. Beyer specializes in wildlife, and he works for us. And because of that, people bring wildlife to us. For whatever reason, we got put on lists. And I find it incredibly depressing because about 85% of wildlife is put to sleep. And we have all kinds of really good groups to send animals to, but they're always full. And you walk back there and just carnage of, dead squirrels or whatever is coming in, And then so many people interact with raccoons in a way to where you have to euthanize them and test them for rabies and things like that. So wildlife is not very rewarding in my mind and very depressing, but someone has to do it. And once again, it's a matter of putting your big girl and boys and panties on and moving forward.
I also think, if you don't mind, think that so many issues with wildlife and exotics come down to husbandry.
Yeah.
And again, that goes back to education, right? And I don't know how much of that is on us. I don't treat wildlife. I know how to hold a bird for, an exam, and I know how to hold, restrain animals, but that's not my thing. That's not what I do. So I'm not the one to educate, but there are certainly lots of us who do this who, could be educating about good husbandry, which maybe would lead to less euthanasia, and good wildlife hygiene, don't play with raccoons, for example.
Bay scarabs,
don't pick up a bat.
Yeah, that was a brain issue.
Don't bring a bat to your elementary school show and tell, for example.
Adam, unless you're dying to say something
I'm
extra,
good.
You're good. Okay, because this is like a 360 veer to the next several questions actually, which are linked to one another, but they center around compassion fatigue. So I'll just read this to you. How do you feel that the emergence of Wow, I'm afraid to ask this.
Important stuff.
You ready? How do you feel that the emergence of corporate veterinary medicine has contributed to compassion fatigue?
Well, I stand here proud. So I will proudly say that our hospital is a corporation from VetCorp. So shout out to VetCorp because I have been through the transition period of acquisition and partnership, and yes, it's been a stressful period in the beginning because no one knows what the future will hold, but I couldn't have asked for a better partnership from being a co-chief of staff with a corporation. So as far as that goes, I would take away that negative stigma that could be associated with the corporation level. I can't speak on all of them, but from my standpoint, and I know from Dr. Brongo's standpoint, we are very happy with where we're at with them. But compassion, fatigue, and self-care, that's my stickler. I'm really big on that. It's really important. And I always tell all our associates and technicians, everybody find you. Whatever makes you you and what you want to do, don't ever lose sight of that. That is so important. Whether it be exercising or fishing or working out with your friends and reading a good book, you got to have that, and it's so important. I really, really value that with the team.
And the corollary to that, I'm not going to have time to let you all go. If you have something really important to say about that particular thing, by all means.
I will say I think there are some good corporations and there are some not so good corporations.
Well, yeah, I'm trying to keep it away from the corporate discussion. That'll be next year's Crossfire event, so please come back in 2019. But the question was, how do you deal with, or do you have a program or plan to deal with compassion fatigue in your employees? Because it's inevitable for all of us, especially when you're doing that kind of volume, I would think.
I think you have to remind the employees, and the truth is, I think they have incredible compassion towards the animals. I think they can be a little rude to clients from time to time, but I think more than anything, they end up kind of being rude to each other, and you can just see cycles of it. And it stems more, I really do believe, more from just absolute neglect. I mean, well, this just got like, everybody's been there. Oh, it just got like this yesterday, and everybody rolls their eyes, and dogs like this. And I mean, our average bone surgery is usually 3 weeks old. Now think about that. Oof. Now you're trying to fix something that's been broke for 3 weeks. And I'll just say, most of the time it's been to 2 or 3 other vets before they find us, and they come in with $1.95. So, you just got to be vigilant about it all the time and be aware of people. But I mean, the kind of people that end up working for me are pretty thick-skinned, tough people. A lot of them like to do karate and box and do things like that. And I think, you have to have your outlets.
Do you hire for that specifically?
I just look for assholes, quite frankly.
Thank you for sharing. Next.
I think that sometimes the toughest people are actually hiding something. We lost a technician in North Carolina recently. She euthanized herself in the clinic, and nobody knew that was happening because she presented a face that seemed like everything was okay, and she was looking forward to things. She had just bought a house. There were lots of things in her life that she had to look forward to, and I don't think anyone had a clue that there was an issue, and that's a problem. Yeah. And I think that we're not vigilant enough. And I think that we take people on face value more than we probably should. I think we should be checking in with each other more. And I think we should be recognizing more that there are mental health issues around our profession, regardless of whatever mental health issues we bring with us to the job.
And the next question is all about that. So did you want to say?
We have some of our clients are social workers, and we have them come in for our lunch and learns too, and we connect really well with them to every now and then. If they want to do one-on-one, we're more than happy to provide that, give that opportunity for them. I'll give you a perfect example. I mean, it's not a good one, but I lost my parents this year, just weeks apart from one another, and it was just horrible. And I wouldn't be standing here with you if I wouldn't have the most amazing team and support system of having like social worker of a client. Fantastic opportunity. So it's a really sad but good example that self-care gives me the ability to move forward each day.
It's interesting, and now we're going to turn this whole thing into a therapy session, which is awesome. I do think we have a therapist out in the audience, so we're in good shape here. I'm trying to see where she is. So she's out there somewhere. So this will be our first official therapy question right now. What are your opinions on the technician grieving or showing emotions with the clients?
Oh, you should answer that.
Me?
Yeah.
I mean, I think it's entirely appropriate, and I do. I cry at almost every single euthanasia. And I mean, I think there are some that I feel it more.
Yeah.
But I think that it's a hard question because everybody has a different emotional response for themselves and a different capacity for emotion. And I'm not judging people who do or don't cry at euthanasia.
Yeah.
And it obviously matters the situation around it. Sometimes it's actually joyful. And I don't cry because it's a release and it's a gift that I'm giving the owner. But I don't have trouble. I don't have trouble showing my emotions.
Okay. Yes, we know that.
I mean, anger can be an emotion, for the record. So I mean, I think it has to be in context, and I certainly don't allow people to, curse or raise their voice to people in my office. That's grounds for go away right now kind of thing. So in the end, I mean, but in terms of like in euthanasia and things like that, I feel like I have some really compassionate, caring people, and I'm definitely for that. There's nothing wrong with that whatsoever.
Super therapeutic. Yeah, I'm all for it, of course. Yeah.
So I feel like whoever wrote this is most likely a technician, and I hope you're not getting pushback about this in your own clinic. Or if you are, you're getting some big-time support up here.
We got your back.
If you are, come and talk to me in the cocktail hour, because we should talk about it.
Yeah, I've never had a client be disappointed or upset by someone having a genuine emotion. I don't think it's good if you're sort of blubbering more than the client is. I'm not even trying to be funny about that.
No.
I think it has to be in the context of you're the professional, but if you're moved, you're moved, and that should be permissible, I would think.
I think it connects you to the client. I think the client feels your emotion, and you're clearly feeling the client's emotion, and it's that added connection.
Wow, this is all going down such a crazy road, and I guess I'm excited about it, but I'm not sure.
Thank you for asking questions.
Because now they want to know your thoughts on vegan vets
I'm sorry.
Thoughts on what?
Wait, just stay tuned here. Vegan vets, not just your thoughts on vegan vets, there's more.
That's a simple one for me.
Yeah, you were ready to start, right?
My wife's vegan.
Okay, but no, let's get the whole question here. Practicing their own beliefs within their practice. Like, for example, they won't suggest meat-based products because it violates their own personal beliefs. Does anybody do you have some strong thoughts about this?
I mean, my wife's a vegan, and she fudges every now and then, but she's pretty hardcore, and I'm on again, off again vegetarian. I really do my best to be that way. I do eat shrimp. I don't have any compassion for shrimp, for the record. So, but in the end, I mean, I think, do we eat the objects of our compassion? I think, and that's one of the things about our profession that just, you have people at the other end that are, all about high production of cows and pigs, and I mean, those are sentient creatures, and it's easy for me to say, I mean, I really believe the world would be a better place if everybody was a vegetarian and probably vegan, It's not going to happen. I live in the real world. If you drive a car, you fly a plane, you kill things indirectly no matter what. You eat processed food, you kill things indirectly no matter what. So I think, you be compassionate to as many animals and people that are in your surrounding, and that may be as good as it gets. There's no such thing as purism.
Mm-hmm. No, to each his own. I mean, I love to eat, so I mean, I'll eat. But I mean, it's completely respectable too. There's nothing, no right or wrong, but I think it's really nice to respect each other's values on those things.
Right. I think the question is really, do we impose those personal beliefs on our clients' animals? Is that what the?
I don't think we can do that.
No.
I mean, I think that part is probably it's probably not appropriate. I mean, I guess it depends on the context. Certainly, it's unethical to recommend a meatless diet for a cat. So that would be an area where I would have a really big problem. But other than that, I think it's certainly something, if you have respect for each other, you can discuss it in a respectful manner. You can try and nudge someone in a certain way, but when they tell you what they're going to do, then that's what they're going to do.
Okay, great. So we're going to pivot hard again. Are you ready? This is an interesting question. So how do I manage to give my own pets the gold standard of care when I can't even afford to do that on a technician's salary? And let me just add a part to that question that isn't here, right? Which is, and how do I then talk to clients who can't afford it if I'm in that same exact position? Is that the rest of that question? So I see all the texts are going,
so.
Yes.
I mean, I think that's an amazing question.
Yeah.
And I think it plagues a lot of technicians. And part of it comes from practice policy, so giving inadequate discounts maybe is the way I want to put it, or not finding a way to help your employees provide that care. But now it's different, right? If I want to go to a specialist and I can't afford it, it's a tough discussion.
I'm going to ask both of you for a second. So do you have these discussions with your technical staff? Can you afford the care here? And if not, what do you say to our clients when they complain about that? I mean, that's an important conversation to have. Maybe even the front office staff who may say, yeah, I know, I couldn't do it either.
Right.
But these should be discussions that are happening in your hospital, I would think.
Yeah, I don't think it's a sticking point for when we hire anyone. I think a big thing that we as veterinarians, just as a common courtesy, is we don't charge for our services. So ear cytologies, an exam, anal glands, nail trims, those things because we know the technicians are on a fixed budget, of course. So we do everything we can to keep their services as low as possible. And I think as a profession, we should extend that common courtesy throughout specialties or whatever. You do what you can to of course, make a profit, but also help out the team. This is one of the perks of being within the profession, of course.
That's the corporate in you. You don't make a profit.
It's not a corporate thing. I think it's just the right thing.
You don't make a profit on your own employees. We don't charge. Occasionally my employees may pay for some drug that's expensive that they need, but I can't imagine charging my employees. It makes no sense to me.
But
I feel like I pay pretty well.
Right.
And quite frankly, we get doctors, young doctors, and technicians bring their animals to us that work in clinics within a mile, 2 miles from us. Makes no sense.
But what if an employee their dog has cancer and they want to see an oncologist and they can't afford the oncologist? What happens? What's then? Even with the professional discount, which most specialists provide a professional discount to staff members. So then what's the issue there? Because that would be, I mean, in my mind, I'm a big proponent for specialty medicine, and I think we should be utilizing our specialists. They're there. They did all of that work. They have all of that knowledge. We should be utilizing them. So if I want to take my dog to an oncologist to treat their cancer, but I can't afford that treatment, what is the option for me? What do I do? And I don't have a good answer for that. I think that's a very prescient question, whoever asked that.
It is a good question, and in the context of this discussion, for me, it still goes back to, how does that person represent?
I think that's
if they're facing that problem themselves. I think that,
because we're all about compliance, right? We really want to provide, you know, everything that we can, best medicine to our clients and our pet parents, and so they probably feel like, well, I should be walking the walk, you know, and if I can't financially, how could they financially do it too?
And I have heard front desk staff say that when they're going over an estimate. Oh yeah, I know, I couldn't afford this either.
Right, that's not good messaging.
Right.
No, it's bad for your
specialization in veterinary medicine, and you have every new grad coming out of school now, they're afraid to look at their own shadow because they've been taught you have to refer, you have to refer, you have to refer. I mean, I do specialized surgeries all the time, and I'm sorry, get a book out, look it up, and do it. You know, there's nothing a specialist has learned that I can't figure out in a few days. My wife is the smartest person in this room, I'll guarantee you that right now. Her idea of a good time is sitting reading Ettinger in the middle of the night. Now, who reads Ettinger ever, let alone in the middle of the night?
Now you're getting into TMI, okay, a little bit.
But I don't think it's fair to say that, that specialists don't have a place. And I think that a surgeon is a surgeon for a reason. They went through specialized training, they went through residency, they went through an internship, they have specialized training that they spent many years gathering and a lot of money to get, and they deserve to be respected for their specialty knowledge and skill. And I don't think it's fair to say that you or anyone, any general practitioner does as good a job as a surgeon. Not every surgeon, granted, you're probably better than a lot of surgeons, but to say that you're better than a specialist in every case and every aspect is just
I'm not saying I'm better, I'm not as good as a lot of them, that's not the point. The point is, I'm not going to let the animal die, I'm just going to give it a shot, and they're going to send it out the door.
I also don't think that's a fair statement. I think there are plenty of specialists. I think there are plenty of specialists who will work with their clients and have angel funds.
Their clients that have $10,000, sure, they'll love to work with them.
No, who will work with even low-income clients.
You know what's awesome?
Give me a name of a few of them, because I'll send some people their way.
What's awesome is we're getting the next 7 years worth of Crossfire discussions all lined up here. We apparently have someone from the IRS in the audience who would like me to point out at this time.
Oh yes, the appropriate amount of discount.
There you go. You know about that, Liz?
Yeah,
yes.
I do.
Okay. Whoever was so kind as to loan me their iPad should come up here right now and get me out of the trouble I just got myself into, because I was excited and I smacked it with my hand. Now it's doing all sorts of weird things. But 20% maximum discount before you have to report it to the IRS, is that right? No, Liz, how'd you do that? Awesome.
Yeah.
Thank you.
You're welcome.
Okay, you ready for this? I'm just changing the topic because I can, but I'm not sure I want to change it to this. Let's see. What are your views on labeling potential zoonotic diseases? We're helping people with their personal problems right now, I can see this. Before definitive diagnosis.
Oh, are you talking about lepto?
Does that create unnecessary panic or stress, or provide the ability for caretakers to make good choices and reach out for medical advice if wanted? So are you quick to label something as potentially zoonotic before you know, or do you wait?
Oh, absolutely. I mean, you got a lepto case, it's like flags everywhere. Lepto suspect, right? I mean, it's just due diligence and liability, of course. Am I wrong in thinking that? I mean, you definitely should be concerned about those things. Roundworms, hookworms, I mean, all those things that it can happen, cutaneous liver migraines, my gosh, we've seen it. So it definitely is out there. So, yeah. I think it's our due diligence as veterinarians to provide that education.
I think you have to, you know, in Colorado, we're lucky we just don't have a whole lot of those kind of issues. In the tropics, see a lot more of it, but I don't think you need to overreact. I just use common sense, and lepto doesn't spread that easily to humans. For the record, there's quite a bit of literature on it, but you know, you do have to take it seriously is the point. So, and there should be a place to put those animals and keep them separate from other people and other animals, without a doubt.
I got lepto from a patient in the hospital.
Yeah.
Because it was, because no one believed it was really lepto. So everybody was very cavalier about it. And so I mean, it happens. And I think we have
struck by lightning, and people get eaten by great whites, too.
I think we have a responsibility to protect our staff,
there's that.
Especially our staff who are low paid, who probably don't have great benefits, who don't have good health care and can't take care of themselves.
Okay, so a little panic and stress might be worth it. It's better than lepto, is what Liz is trying to say.
Yeah, that's what I'm saying.
Yes.
Okay, awesome. Well, let's segue from that then into this sort of general antibiotic question, which is, of course, what is your position on broad-spectrum antibiosis, pre-spay, I guess, specifically, and just sort of in general, not in the face of known infection? Go.
You never use antibiotics in a routine surgery. There's just no rationale for it.
What about in Mexico?
About a what?
In Mexico.
I don't in any, but some of the people do. They'll send them home on amoxicillin for 3 days, which I think is just a waste, but they don't have resistant bugs there yet either, but they will. Just keep giving them drugs. So I have no problem necessarily with a penicillin shot for a street dog going out, long-acting penicillin, but that would be about it in Mexico. And we have really good follow-up on that. I think we way overuse antibiotics in this country, and if you look at the European standard, it's ridiculous compared to America. And we're seeing resistance that we just shouldn't be seeing.
Yeah, agreed. I mean, we got super bugs hanging out in the United States, so it's one of those things we try to avoid antibiotics preoperatively, perioperatively. If need be, we try to avoid it at all costs unless it's necessary.
You agreed? Is everybody out there agreed on that? Well, that was
then
easy.
who the hell's giving all the antibiotics out? Oh, wait, I know. It's in the large animal industry. Never mind.
Okay. Thank you for that.
You're welcome.
Do you believe that having veterinary shows on Animal Planet oh boy, I just go this way. What do you know about this?
Nothing.
Do you believe that having veterinary shows on Animal Planet increase the veterinary profession's visibility and help viewers understand what vets and techs do?
Oh, I think it helps them understand what vets and techs do. I think, it's apples and oranges in a lot of ways, and I think you can see the high-end shows and the low-end shows. And I mean, you see a CT scan on one show, and a person comes in, I want my cat with a CT scan. I mean, well, it's not real feasible, and that's not the way it works. I think we actually set up unrealistic expectations for a lot of people in society. And I'll just say, our human healthcare system is the same way. If you think you get the same level of care on Medicaid as you do if you have high-end insurance, you don't. Plain and simple, and I know because I've done surgery on several humans over the years for a variety of reasons. But there's just an incredible difference in standards. I'm sorry. Yeah. And in the end, my goal is to let people know that there are people out there who care about them, who care about their animals. You can't care about an animal and not care. I don't understand all of my animal rights friends who love animals, but then they hate people. You care about the animals, you care about the people. It has to be the connection. It's all put together. And I feel like we do our best with what we have, and I think we do a really good job. And I don't see that as a bad thing for the profession. And I don't begrudge anyone saying, oh, I want to go over it. And we offer, would you like to see a specialist? There's not one thing we do that we don't say, can you go to a specialist? We'll refer you over to so-and-so. I can't do it. So, okay, there you go.
But when you have a TV show or a social media platform, I think it's our due diligence to provide exceptional quality medicine of what veterinary medicine should be. Right? And I think it's great that you have a fantastic show, of course, but I also think that, the perception, if you have these young kids that really want to be, I want to do what he's doing on TV, then we should be able to provide that level of expertise too. So at the same time, I think it's important to educate, have fun. I mean, look at all the shows that are out there now. It's crazy. We have wildlife vets, Doc McStuffings, Too Cute, Season 911. I mean, the list goes on. People are obsessed with their fur babies of all different, so we need to make sure we play the part representing the veterinary profession.
Yeah. I would like to see a disclaimer on some shows that is, hey, this isn't real life. It's a TV show.
Yeah.
Because I think there's I don't want to get too deep here, but there's a lack of critical thinking in the general public, and sometimes they can't differentiate between real life and a TV show, and there's a difference.
Well, I think I have more problem with vets that can't distinguish, because right now, if there's a surgery going on here and I push my hand back over here, oh, you reached over the surgery plane. No, my hand's back here. TV is two-dimensional, people. It's not three-dimensional. And so we have people that have DVMs and PhDs, and they write in and make stupid comments about that. It makes me really wonder about what their true incentives are. Finances. I'll come back to finances. I'm sorry. And I am mad about that. It just makes no sense. How can you charge $5,000 or $6,000 for something I can do for $1,500 and not lose money? Ask me, I don't understand that. And I do $3.2 million a year. I have an 8,000 square foot building. I mean, come on. I got 40 employees.
Have you sat down with those vets and asked them about their costs and what they're doing and why they're charging a different amount of money?
I would love to talk to any of them, but unfortunately they're all hostile. And they've made me hostile now because I was never hostile before. I just felt like I'm just left alone. I'm working here trying to do the right thing for as many people as I can. And then I get attacked by 14 different people. And I love when they write me up to the state board, they never sign their names. They don't even have the guts to put their names down for it.
I mean, I can't abide by that. They should have the guts to talk to you. And we talked a little bit about that beforehand. And I think that's something that all of us in the veterinary community need to do, is be open to criticism and discussion and learning new things and figuring out what's going on with our colleagues before we jump on our colleagues.
Yeah, so you see that.
I'm so excited that this is happening in the last 5 minutes. I can't even tell you. I say that really to you to say, if you're sitting there thinking, oh, I really want to ask this question, but I can't quite, now's the time, because we only have a few more minutes together, and please help me out up here. We're back into the therapy zone with this next question, which is, how do you handle a client that is abusive towards your staff, but has an animal that needs serious veterinary treatment? Wow, you people have some real problems.
Yeah. I mean, we enable some of these clients, don't we, guys? Right? And we enable it and we perpetuate it because, one, there's like, well, they're either great clients, they make a ton of money, or they bring money to the business, they pay their bills, but they're so abusive to the front desk or whatever. No, cut the ties. It's not worth it. Why have a negative staff feeling so, and also as a leader, that's our responsibility, you know? No, just hell no. We don't need that around there. We don't need toxic clients. We really don't. Absolutely. That's where they can go somewhere else.
Yeah.
Or nowhere.
I agree. We fire clients all the time.
Yeah.
There you go.
Yep.
Sometimes I just don't know what to do. I don't have a logical segue question in front of me, and I don't want to sort of veer us totally off. You guys okay out there? You are?
No.
I'm going to ask you to kind of. What just happened?
Somebody's not okay.
Who's not okay? It's your wife. No, I'm just kidding. I'm going to ask you to spend the last couple minutes just giving us a tiny little wrap up on anything you didn't get to say that you were hoping to get to say while we were up here, and any last comments, and then we'll get to the fun stuff.
Oh, me?
Go ahead.
Oh, one of the big things that I was like, I'm a big Disney freak. Any Disney freaks out there? Thank you. We all get each other. Yep. And I'm all about treating the client like a VIP, just like in Disney. And it's a very individualized person or pet or patient. And it really is a customized approach. I just always believe in exceeding client expectations, saying hello to those dogs and cats first because they're your guests in your hospital, then saying hello to the clients, and just delivering an exceptional experience and making your front stage separate from your backstage, and you can just sell it and have an awesome experience and be a great veterinarian and a great team.
Liz?
I don't know that I have anything that I wanted to say that I didn't already say, except that I think that those of us in the public eye who have a platform have a responsibility to the profession and to pets and to pet owners to advocate for the gold standard and to educate about the gold standard and the spectrum and the variation in gold standard. And we have a responsibility to find a way to serve those underserved, low-income, underrepresented communities, and we have to find a way to serve them in a high-quality fashion.
Sir.
Well, I mean, first off, I have no problem with Adams type practice. In fact, I totally respect it. And in my ideal world, I'd be doing the same thing as you. That would be my ideal world. I just chose to pick the other end of the spectrum. You know, 77% of people do take their animals to veterinarians in underserved and poorer communities. I live in Denver Metro, but most of my clients come from all over. I mean, they drive for hours, you know. In the end, I feel like we do a really good job. I feel like I've been beat up a lot on social media by veterinarians who won't even name themselves, which I feel is grossly unfair. And I've challenged multiple people multiple times. You do 100 surgeries, I'll do 100 surgeries. We'll count and just keep statistical analysis and find out, because I'm well aware of what I do and how things come back and don't come back. I think in the end, you're dealing with dogs and cats, and I'm sorry, It's not the same as a human. You know, I've had 16 surgeries in the last 12 years, and I never once chewed out a suture, scratched it, or licked it, or, you know, anything else, you know. And so, you know, things happen on the animal side. You're going to have a certain amount of infection. The national average is 2 to 18%, and that's in all kinds of literature, depending on the type of surgery. You know, we consistently are down under 3%. I feel really good about that. And yeah, we see 99% of our people back because they have no place else to go, you know, especially our bone surgeries and all that. So I feel like we do a good job, and yet people are just outraged because of the fact I don't put a gown on. And it's like, you got to be kidding me, you know, and there's no science on that. It just isn't. I mean, my shirt is clean. If it gets dirty, I change my shirt. And the things are draped, and I'm not rubbing my stomach on the dog or whatever. I just, you know, it's just, I don't get it. And part of it is surgery time, without a doubt. If you read anything about surgery, you know 2 hours is kind of your limit. You start going over 2 hours, SSI rate goes up dramatically. You know, when you can do a knockout at knee in 35 or 40 minutes, you're not really worried about a 2-hour time frame. And that's because I have done 175,000 plus surgeries. You know, so, you know, I don't consider myself an exceptionally talented surgeon. I just consider myself a person with a lot of experience and not afraid of anything, and that makes a big difference. In the end, there's so many people out there that want to do the right thing for their animals, and they can't. And they're not the smartest people in the world. They don't have much of an income, but they care about those animals every bit as much as anyone else in our society. And I've seen it over and over again. A man that came to us, when his dog died, 3 days later, he killed himself because his wife was already dead, his dog was gone, and Mr. Wilson, he came in every day to see us, and all of a sudden he didn't come in. Where's Mr. Wilson today? Found out he killed himself 3 days after his dog died. You know, and he didn't have a pot to piss in. And who are we to sit in judgment of people like that? You know, saying you don't deserve that animal. You know, that was his whole life, and it just goes. Those stories go on and on. I just don't know. I don't know how to do things different. I don't want to do things different, and I feel like we do a good job, and I just want to do it for the animals and for the people.
Thank you very much for that. Cross-examination?
Okay.
So that's actually the end of our first Crossfire. What do you think? Should we keep this up? Okay, so next year we meet here again. Right now, just one reminder, which is that there's a general session in this room, this very room, tomorrow morning at 7:30 to 8:30. I want to thank the three of you for sure for coming today and providing this lively discussion. I want to thank you for joining us and participating, and I hope you enjoyed it. And as a small token of our appreciation, there's a bar in the back and some really good food. We'd like you to join us for our reception. And we'll see you tomorrow for the CE program.
Bye, guys. Have a great conference.